Hey everybody, Dr. Julie McLaughlin here with McLaughlin Care. Today we're on Functional Medicine Friday. We are going to be talking about the MTHFR gene. If you've done labs with us before, you know this is something we test for in the office. And if you haven't done labs with us before, you might want to think about getting this marker tested, and we're going to find out why. And if you've been following us on our Wellness Wednesdays, you know Dr. McNamara is going to be running in the Chicago Marathon, and he is raising money for research on spina bifida. And we're going to talk about that a little bit more because spina bifida is associated with this marker. So when we talk about this gene, we're going to talk about folic acid, folate, things that affect the brain, heart, and spine. So some patients were saying MTHFR, like that looks like a swear word. And I'm telling you, it's not a swear word. It's a methyl tetrahydrofolate reductase. Now you don't have to remember that long word. Just remember MTHFR. And it's a methylation problem, right? So what that means is that if you have this gene, and we're going to talk about it more in a second, you're not efficiently converting folic acid into folate, even if you take it or if you eat it, because you don't have the enzyme genetically to do that. So this is the way it works. Our genes are very unique from person to person. With this type of gene, you get one copy from your mom and one from your dad. And these two genes help determine how our bodies are going to interact with food and vitamins that we consume and diseases and conditions we may be predisposed to. Just because we have this gene doesn't mean we're going to get that condition or have that problem, but it definitely helps us know what we're going to treat. So when we look at it, who's at risk? 70% of the population has this gene. 30% has two of these genes, and that would be considered homozygous. That would be considered that the symptoms or disease conditions could be expressed in its full extent, right? 40% have one gene. This MTHFR is linked to 40 different types of diseases. You're like, oh my gosh, don't sign me up for this. I don't want this. But there's a really good chance if you're in that 70% that you may have this. But the good news is there's things that we can do to prevent it and turn it off. And that's the biggest thing, is just knowing about it and knowing if you have it and what to do about it. So these are some diseases that are associated with this gene. Alopecia areata, which is an autoimmune disease where we lose big patches of hair. Encephaly, right? So that's also called neural tube defect, when a baby's brain is born missing part of their brain or part of their skull because their spinal cord and their brain is either just missing or is on the outside of the skull. Homocystinuria, that's when your homocysteine is high. And we're going to talk about the homocysteine. It's a substance. It can cause a heart attack, but it's not linked to cholesterol. It's linked to this MTHFR and folic acid. Praxis is an age-related hearing loss. And with certain, combinations of this MTHFR, you can get hearing loss. Like, so wait a minute. We can correct these with some supplements. If we know specifically where your markers are, we can definitely turn these off and prevent them. Spina bifida. So this is the big one that we've been talking about. We're going to be talking about here for the next months to come. It is a birth defect, and where the bones and the spinal column or the spinal cord, they don't close completely around the nerves. And sometimes the spinal cord can be on the outside of the body, right? So some babies don't survive this, and the ones who do can definitely be severely impaired. It can also cause heart disease, strokes, hypertension, preeclampsia in pregnancy, which is high blood pressure during pregnancy, a glaucoma, babies with cleft lip and palate. It can also cause miscarriages, difficulty getting pregnant. So there's so many things. It can cause blood clotting. So it can cause a lot of things. But I'm here to tell you, if you know about it, you can turn it off. So when we look at B12 folic acid, These are two water-soluble vitamins. So what's one thing we know that moms do when they first get pregnant, or even when they're planning to get pregnant? They take prenatal vitamins. Why? Because they're really super high in B12 folic acid, which helps prevent cleft lip and palate, spina bifida, neural tube defect, right? So this is one of the leading deficiencies in the world. And many parts of the world, it's more severe than here. So our government has fortified our food with B12 folic acid, which is great. But if you have two of these genes, even when you take that B12 folic acid, either in a over-the-counter supplement or in your food, you can't convert it, so you can't utilize it. So folic acid is also known as B9 and is essential for other vitamins to work for your nervous system, your brain, your immune function, and the conversion of folic acid. So let's see what we can do. So when we measure these genes, it's a one-time test because your genes, whatever it is. But we monitor how it's working by measuring your B12 and folic acid. So when we use the supplements, we use pharmaceutical grade. This is from Zymogen, one of the companies that we use. And we want to activate that enzyme pathway. So you can't just take regular old B12 folic acid because it's not going to have the enzyme. So this one specifically has the enzyme you need to convert it because your body doesn't make it. So if you're interested in getting this, you know you have MTHFR, you're worried about getting MTHFR, you can get it at Zymogen.com, which is also Whole Scripts. And the passcode is going to be Get Healthy. And they'll ask for the doctor's name, and you can put McLaughlin, and you'll be able to order those. So we usually do 1 to 2 of those. They're water soluble. They make your urine really fluorescent yellow, but there's no side effects of it. So like I said, Dr. McNamara is going to be running in the Chicago Marathon this year, and he is raising money. He's hoping to raise $2,500 in the support of spina bifida research. So as a chiropractor, he knows the significance of spinal disorders and how they impact people's lives. So if you're interested in helping him help support spina bifida, here's a little Q code. We also have a link on our website. And he's going to be doing training videos for the marathon for all you runners every week. And we're going to have a lot more information about the spina bifida as we're linked with the Illinois Spina Bifida Association and raising money for their efforts. So what can you do at home? You can do a lot of lifestyle things. So I'm going to go over these, but I also have some handouts for you if you're interested in avoiding this darn MTHFR. So these are common recommendations that you can do. The first one is going to be limit folic acid fortified foods. Remember I told you the government fortifies it because you can't process it very well. You want to avoid or limit over-the-counter supplements with it in it. It can actually make you sick because you're taking something that your body can't utilize. Avoid folic acid blocking drugs, birth control pills, or methotrexate will block the folic acid. Avoid drugs that increase your homocysteine. Remember, homocysteine is a substance that can cause a heart attack not linked to lipids. Nitric oxide is one of those at the laughing gas that you get at the dentist that can cause a problem, right? Avoid antacids. They block the absorption of B12 and other nutrients in your body. So other things you can do is you can take an infrared sauna. We have infrared sauna here in the office. You want to get a good sweat going on a regular basis. Your Epsom salt bath, sports, and yoga are great ways to sweat, especially if you do hot yoga. If you can do that at least 1 to 3 times a week, that'd be really good. Because one of the things with the MTHFR mutation is you don't detoxify very well. So we want to do things to help your body detoxify. You want to limit the intake of processed foods because you don't want to have to detoxify all those chemicals. You want to drink at least 2 liters of filtered water a day or half your body weight in ounces of water per day. Avoid cooking, drinking, or storing anything and heating it in plastic containers because that can leach into your food or your water and your body has to detoxify it. Use air purifiers in your home and office to keep that air clean. The other thing is you want to understand which of your symptoms may be related to the MTHFR mutations. Because this is just a quick little video. I'm not going deep into the different alleles, but there are two, a 677, which affects the heart and your cardiovascular system, and the 1298, which affects the brain. So some people can get blood clots from this. Some people can get Alzheimer's dementia, heart attack, all of those other things that we talked about. But the way that we know if you're not going to be affected by this, again, is measuring that B12 folic acid and measuring your homocysteine in your blood. Inform your family members. It's genetic. If you have it, we know your parents who gave it to you and or your siblings may have it as well. Eliminate gluten from your diet, especially the wheat gluten, because it affects our immune system. And so that's going to help you out too. And limit or reduce your dairy. If you're going to have dairy, maybe do goat's milk, because the dairy is inflammatory and it's going to help you overall with reducing symptoms associated with this condition. So that is it. That is our Functional Medicine Friday on our MTHFR gene. If you have any questions, let us know. We'll see you next week.